And I want to welcome you to this brief presentation that I'd like to give out to you guys today over the topic of seizures and epilepsy. And this talk was inspired to creation to get that information out there into the hands of parents as well as individuals who are struggling with any type of seizure or epileptic case, a family member, or a child that they have with such. As we go through this, guys, if you have any comments, please share those in the feed below. Like it. Please also feel inclined. I encourage you to share it with others at whatever point feels right for you. The more that we can get this word out, the more chance that we have of helping another individual out there who struggles with this type of health challenge. So again, my name is Dr. Kurt Aher, and I want to thank you to this presentation. In our office, we stand behind this purpose in that we exist to unlock the healing potential of the nervous system for you, your child, and your entire family, regardless of condition, disease, or diagnosis. So it doesn't really matter what it's called, because there's a lot of different diagnoses and labels out there. And no two seizures or epileptic challenges are the same. I think you would agree. So regardless of what it's called, what we want to do is we want to take a step back and say, what do we need to do to really better understand the cause, the why, and then what do we need to do to get some actual results, regardless of what we call it. We provide you hope that when this healing potential of the nervous system is allowed to be released, miracles and full expression of life begin to take place. Thank you for allowing us to serve you and your family. As far as I go, I've been in practice now 7 years here in Milford, small little town between Northville and Ann Arbor, Michigan. And in that time of 7 to 10 years, what I've noticed is that individuals are coming in with a lot of different health challenges. They're on a lot of different medications, and they have a lot of different struggles. And those individuals and those parents with kids that have challenges with seizures and epilepsy are no different. In my belief system, I believe that every child and individual is born to be healthy and not sick. That sickness or disease, regardless of diagnosis, is merely the absence of health. I believe that the restoration of health does not require the use of drugs, medications, tests, or procedures, but rather requires a better understanding of what actually caused health to be lost in the first place. I'm a graduate of Albion College 2005, member of Epic Pediatrics with over 300 plus course hours with training in pediatrics and neurology. I've been in family practice since 2010. This right here is my family. This is my wife, Brittany, and our son, Breslin. We've been married for 5 years now. My son, Breslin, is going on 2. And I put this picture up not to say that we're the perfect picture of health, because we all have our health challenges. But my son, for example, he doesn't struggle with any of those health challenges. He doesn't have seizures, he doesn't have epilepsy. And again, I don't say that to impress that upon you, but rather to make a point that I truly believe children are designed and born to be healthy. You see, they have all their parts. At some point, however, health for that individual, for that child, is lost. And that's not a normal procedure. So we've been married 5 years, and we're just having a great time. When growing up, and I think you guys all remember this rule, really 2 rules. The first was don't call each other names, right? Yeah, we have names for all different type of seizures and epilepsy attacks these days. We have the grand mal, the petite mal, convulsive seizures, clonic, tonic, myoclonic, partial seizures. And again, this is by no means the whole list, right? There are many different types out there. These are some of the main ones that we hear about. On the right side here, we have the sensory, the motor, the autonomic, which I found very interesting also. I'll talk a little bit more about that in a moment. And then we have the psychic seizure episodes as well. So regardless of whether you see your particular seizure on here or not, I want you to kind of take yourself out of the diagnosis, out of the label today, you're more than welcome to put your seizure type in the blank. But again, it doesn't really matter what we call it. The purpose of this talk, again, is to talk about what are some of the main causes. What do we know about the science? What do we know about the neurology? And how do we go about correcting that so that we can get you or your child some fantastic results? The second rule, don't do drugs. Yet, as many of you are aware of out there, we have drugs for every type of seizure out there. Keppra, Aptium, Tegretol, Klonopin, Diazepam, Valium, Depakote, Neurontin. Again, insert your drug here. And oftentimes with the individuals that I've talked with, it's not necessarily just one medication that they're on or trying at the time, but it's multiple different types of medications that they're on at the time, trying to manage drugs, trying to manage dosages, trying to manage symptoms. So again, there's a lot of stuff going on here, and what we want to do is we want to bring the information, what we do, to light so that you can start to get some answers. And that really brings us to our next point, really, and our belief system that proper care, guys, really requires proper understanding of the cause. What is the cause for many of these seizures? What is the cause for epilepsy? And while modern medicine has done a very good job at labeling and diagnosing, quite honestly, they have failed miserably, absolutely miserably, at addressing and removing the true cause of the neurological disorder, really the why behind it. So for those out there that have been to the pediatricians, to the neurologists, to the specialists, to those individuals who have traveled for yourself or for your children, for your child, to the Mayo Clinics, to the Cleveland Clinics, to the children's hospitals, to the university hospitals, to the Harvards, to the Johns Hopkins, to the Stanfords, to the University of Michigans, where I'm from, to the Motts. All right? You've been everywhere, but you've never really gotten these answers. So what you're about to hear, and hopefully better understand, I truly believe is going to shed some light on what you've been through and the questions that you've had these years. When we talk about the cause is really an algorithm, if you will, a sequence of events, ingredients, environmental factors, that left unchecked and uncorrected really add up over time to become the diagnosis. And again, whatever that diagnosis is, it doesn't really matter. The three things that we look at in a case history for an individual or child that is struggling with seizures or epilepsy are what we refer to as the 3 T's. We refer to them in the lower left-hand corner as the emotional stress or the thoughts, at the top the chemical stresses or the toxins, and in the right lower the physical stresses or the trauma. Guys, these are the main 3 key ingredients that either by themselves, individually, or in combination feed what we refer to in my field as the subluxation. And we're going to talk a little bit more about that in just a moment in more detail. For the time being, when you see the term subluxation, I want you to think stress on the nervous system. And if you hear me say stress on the nervous system, I want you to think subluxation. So these are going to be the 3 things that we look at in a little bit more detail here, and ultimately how these 3 things drastically affect the neurology and the brain function of either you or your child that's having a struggle with any of these issues. The first thing that we want to look at in a case history, and guys, this is the conversation that I have with every parent that comes to the door, regardless of the diagnosis, is what have they been through from an emotional standpoint? The stress patterns that have accumulated in the system for many months or years. And we go back to the birth process, all right? The amount of stress, the amount of emotional stress that's placed upon the mom during her pregnancy. And ultimately, guys, at the end of the day, any stress that mom is under, who also gets wired for that stress? The child, absolutely, the child. And so you can see here that these children start to get wired for this state of stress very early on sometimes. Oftentimes, there are many tests and procedures that these women undergo with their children. Multiple ultrasounds. Oftentimes, there are stressed forced labors and induction scenarios that take place. Oftentimes, there are extended NICU stays for these kids when they're born. Ultimately, at the end of the day, when complications arise, We get into many, many more tests, many, many more procedures, whether those be MRIs or CTs. And if the diagnosis of the seizure or epilepsy is made, we then get into the realm, as you guys are aware of multiple EEG studies, brain mapping, surgeries, etc., etc., etc. Place your procedure there as well, whatever that may be. So the first thing that we look at are the amount of stress patterns that accumulate within the child's nervous system. The second thing that we look at in the case history and how it ties in to the diagnosis or the label are the traumas that are induced onto the child and the child's spine at a very young age and very early on in their life. From the very beginning, oftentimes, there is intrauterine constraint for the mom and the child. The baby gets stuck within the birth canal. And moms out there, if you're going through this birth process or this slide, I want you to kind of think back to your own birth with your child and see if any of these hit home to you or you recognize any of these on your own. The whole idea of birth trauma, all right, forceps being used, vacuum extraction being used, complications, the cord being wrapped around the child's neck, cesarean sections, all right, or C-sections, I'm sorry. There's a lot of trauma that takes place within the birth process. We don't oftentimes think of it as trauma, but let me tell you guys, it is such a traumatic experience for these little ones when they're born. And I want you to think where all that stress takes place. Where do they pull these kids out? All right. They pull them out by the head, by the neck, and by the brainstem. All right. That's where all that neurology is located. So in addition to the trauma at birth, I want you to think about going back in your history if you struggle with seizures or epilepsy, or your child, if they struggle with seizures or epilepsy. Did they have slips? Did they have falls? Learning to walk, falling down the stairs, off the table, off the bed, off the changing table? Did they have a history of concussion, multiple traumas to the head and neck? Were there car accidents? All right. Those are some of the things that we look at, the trauma to the spine for these individuals. And then ultimately at the end of the day, how it affects the neurology. So this is the second T, trauma, that we look at. The third T is what we refer to as the toxins or the chemical stress that oftentimes takes place in each of these scenarios. All right, Pitocin, epidurals, which can cause an increased incidence of cesarean, multiple rounds of antibiotics in the very early months and years of the individual's and child's life, further stressing the nervous system, wiring it for stress, further and further, deeper and deeper. Multiple medications, Prevacid, Tylenol, Miralax for digestive issues or constipation, nebulizers, inhalers, steroid-based medication that these kids are on from a very early age. All right, you get into the vaccine ingredients, mercury, aluminum, fetal lung tissue. All right, guys, these are neurotoxins. These are known toxins to the body that can have negative effects on your child's neurology. Okay, and then you have multiple AEDs, anti-epileptic drugs, which we talked a little bit about earlier, and there are many of those as well, as you guys are, I'm sure, are very aware of. So this, guys, is really the new normal out there, right? When you look at all these things and how they add up, either by themselves or in combination, at the end of the day, you really do get a neural shitstorm for the individual, for you, or for your kid. And there's so much stress on your kid's neurology, the nervous system doesn't know how to handle this neural shitstorm, so to speak. And so as a result of that inability to adapt to the stressors, primarily these three T's that we just briefly discussed a moment ago, is going to determine how your child has an ability to either function or not function from a neurological standpoint. So when I come into the picture and I review these case histories for the very first time, I really start talking to these parents about what I do. And yes, I am a chiropractor. I was trained in the chiropractic profession, as well as the pediatric realm of chiropractic and the neurology of chiropractic.